I am ready.
Hi, it's Jerry, and we're back with Zoom chat, and we are joined by Representative Salud Carbajal, who has just flown back to Washington for a big vote. Congressman, thank you so much for making the time for us. Now, tomorrow morning, we're talking Wednesday, so on Thursday morning, I guess the House is set to vote on the latest bailout legislation, which has already passed the Senate. Can you tell us what's in that bill?
Yes, it's going to incorporate $484 billion, additional dollars, I should say, building on the CARES 1.0 package that passed a few weeks ago. This is really to replenish the fund for the Paycheck Protection Program that ran out of funds. And so that program is getting $310 billion, with 60 billion of that going towards small to medium-sized lenders. There was a question as to who was able to lend out the money where the bottlenecks were at. So this is also providing an additional $50 billion for the economic injury disaster loan program as well, and $75 billion for healthcare funding and personal protective equipment that hospitals are going to get now. Now, in addition to the 50 billion idle loan funds that were provided in this bill that initially were not in the bill until Democrats negotiated more, is the testing, $25 billion for testing. Initially, the bill that was proposed did not include testing or more money for idle. So I'm happy to see that the negotiations between the two parties led to a more productive and positive outcome for all of these different programs and people that are hurting in our districts.
Yeah. So let me break it down a little bit. Let me ask you about some of those specific things you just mentioned. The money for the Paycheck Protection Program is targeted for small business, correct?
Yes.
And so what is that going to mean for us here in Santa Barbara and obviously people throughout your district in San Luis Obispo as well?
Well, what it's going to mean is that people that were caught in the process when the fundings ran out, that they're going to be able to continue processing their loans. It's also going to allow a whole new group of individuals who didn't get to process their loans to be able to get back in line and to process those loans so they could get economic relief. That's what it means. It means that the relief that was initiated with the CARES 1.0 Act is now going to be replenished so that people can continue to access those funds. And so that's a very good thing for our district.
And then $25 billion for testing. I've been talking to a lot of your colleagues, elected officials and people in government, and that's, the big issue. We don't have enough tests to be able to figure out what the denominator is to know where this virus is. How far is 25 billion going to go? That's not going to be enough for a national testing program, is it?
Well, at this point, that's the amount that they came together on. But what it also does is requires this administration to develop a strategy, not just to here's more money for testing, but develop a strategy of how you're going to work with the states to roll out a strategy, to roll out the production of test kits so that communities and jurisdictions across the country have these tools so that they could better have a better strategy based on science and information and data to be able to reopen their economies and their communities.
Do you know how much that's going to mean for California?
I haven't seen the actual distribution and how it's going to be done, but at this point, all those issues will be resolved in the near future.
How big is the bill? Have you seen that? Have you actually?
$484 billion. The bill is, it's a pretty lengthy bill.
Have you read the whole thing yet?
No, I just got it. I just got into my desk. So now you know what I'll be doing tonight.
What was it like flying? Was that weird?
It was weird. It was, I would say the plane was about 1/5 full. And the airport is the one that seems like a ghost town. You're walking through the airport and literally you might see in a span of 100 yards, 200 yards, 15 people. It's kind of eerie. It's sort of a very Twilight Zone looking.
Did you fly out of Santa Barbara?
Actually, I flew out of Los Angeles because we have limited flights out of Santa Barbara.
Yeah.
So my wife, this morning, we left at 4:30 in the morning to LAX, and then she drove back home.
All right, let's go back to the bill. I talked to Supervisor Hart last week and several other people, and it seems there's been an issue because Santa Barbara County has less than 500,000 people that we've been sort of on the short end of the stick in terms of getting some relief. Can you address that problem, and is it that fixed at all?
Well, that's what we hope to fix in CARES 2.0, which is the next package that Republicans and Democrats have already said they're going to work on. This president has already tweeted that he's committed to addressing the needs of local jurisdictions.
So you're assuming that what he said he's going to stick to?
Well, let's hope so. Well, the American people can hold him accountable as well. So, but let's hope so. We hope to be able to address more funding for cities and states and local municipalities that are under 500,000 population in the CARES 2.0. But keep in mind that in the CARES 1.0, there was $150 billion for states and local governments. For communities or municipalities that were 500 population and above 500,000, they could get direct relief from the federal government. For those that were below 500,000, regrettably, they have to work through the state to get some of that relief from the funding that the federal government made available for state and local governments, but via the state of California.
So but that's basically all the local governments in your district.
Yes,
And that's why that.
I have signed on to letters, I have signed on to bills. I have been advocating that in CARES 2.0, we really need to come up with a better formula, but certainly no cap, because communities in municipalities in my district will be shortchanged, and we come up with some arbitrary cap, even if it's 100,000. Many cities in my district are under 100,000, and for that matter, under 50,000. So I'm not for coming up with a cap. I'm for looking at other formulas that will provide more robust and equitable funding throughout the nation, and specifically on the Central Coast.
All right. I know the Speaker, Pelosi, was really, and Senator Schumer, by all reports, were really pushing hard to get more money for state and local government in this bill. Why are the Republicans or why were they so against it?
I have no idea, other than they were adamantly against providing support and relief for local governments and municipalities and states. They were entrenched. This was a non-starter for them. And as a result, we were not able to get the relief we had hoped for and were advocating for local governments and states. So what we did get was a commitment from a number of stakeholders that this would be a relief that would be provided in CARES 2.0.
All right. What's the latest on the situation at Lompoc at the prison? I know you and Senators Feinstein and Harris have been working on that, and I guess you got the mobile hospital set up, but that's really a black swan. That's kind of the heart of the outbreak for us right now. What's going on?
Well, the strain that Lompoc Prison will provide on the broader healthcare delivery system for the public at large is significant. So that's why I wrote now 2 letters with Senator Feinstein and Senator Harris to the Bureau of Prisons saying, you need to fulfill their orders ASAP for the mobile medical facility that needs to be sited there, for more protective, personal protective equipment, and more ventilators. If not ventilators for the specific site, ventilators for the local hospital that is now taking many of the patients in form of inmates from the Lompoc prison. Certainly, we've been pushing for all these items to be expedited. I understand that by this Friday, we will have phase 1 of a 2-phase implementation effort finished, where they will put in 11 rooms and 11 to 20 beds immediately made available. But we haven't gotten
on the grounds of the prison.
On the grounds of the prison. They're working, it's my understanding that the Army Corps and the Bureau of Prisons is working with a company by the name of Aspen, and they're trying to work with them to bring the personnel, retrofit the existing brick and mortar facilities that exist there to put in these resources there in the prison. But certainly, this is of great concern. It's already a crisis, and it could become a disastrous circumstance that is unfathomable.
So what's phase 2 then?
Phase 2 would be to round out the facility from 50 to 100 beds to be able to ensure that the personnel is there and to really provide for all the other equipment that we requested be done in these letters. Also, there's a lot of personnel, law enforcement personnel, that we have heard are sleeping in their cars because they're scared they're going to get contaminated by this virus and pass it on to their families. So we've also asked that the prison take measures to provide interim transition facilities for many of these staff workers and law enforcement personnel that are working in the prison.
So what's your takeaway on it? Are you getting, in terms of a response from the Bureau of Prisons, are you satisfied that they understand the urgency of this, or are you still getting a runaround?
Well, to date, we have not gotten an official response. Let me put it that way. So, of course, it's with great concern that I continue to have, as well as Senator Feinstein and Senator Harris. But the fact that they got on the ground immediately with the Army Corps and Aspen does demonstrate that they at least got the sense of urgency. I've seen some positive signs, but then again, without a response and without understanding clearly the timeline by which they are implementing all these improvements and measures, all we can do is continue to be concerned and continue to be loud advocates, raising these issues and the sense of urgency.
Do you think that the lack of a response is politically motivated? And, you know, this is California, not exactly President Trump's favorite state, or do you just think it's incompetence?
Maybe a number of factors, but I will tell you, I wouldn't put anything past this administration politically. We've seen all the things that this president has done regarding California being vindictive, retaliatory. But I would think that, I think the Bureau of Prisons was caught flat-footed with this pandemic, not having the type of plans, not having the type of measures, the type of resources that need to be included in action or contingency plans. So we're seeing that with the Lompoc Penitentiary.
All right. I spoke with Senator Jackson and Assemblyman Limon, and they both expressed concern about trying to find some funding for Sansom Clinic. Is there any money in this new bill or anywhere that you're aware of that would be available to community clinics of the type, the category that Sansom fits into?
It's my understanding with CARES 1.0, there is some funding that they would qualify for, but the type of funding that they need is more significant. And they happen to be a unique nonprofit clinic organization that is not owned or affiliated with a hospital. Right. And as a result, it disadvantages them when the funding came forward in CARES 2.0 to really provide the funding that they need to be able to sustain and overcome this challenge. I'm doing what I can to ensure that their unique circumstance is included in CARES 2.0 so that they don't get shortchanged, and that hopefully, if I am successful, they're able to get the resources they need to address the challenge that they're facing. So I'm looking at in every possibility, because you don't need to tell me. I live in Santa Barbara, Jerry, and as you do. And we know that this is not just a little clinic system. This is next to Cottage system in southern Santa Barbara County. it is the healthcare delivery system that provides preventative care and elective surgeries to so many people. So this is not just a little clinic system. I understand the gravity of it, and I'm doing my best to raise the awareness and the urgency that we need to make sure they're included in future funding opportunities.
Okay, but you're talking about the next round of legislation, correct?
Yes, I advocated for this round as well, that they be considered as part of the hospital funding we're providing. But again, I'm yet to wade through that bill to see if they are included again or again are left out. So, but I will continue to fight, not only for the CARES 2.0, but if I have to move forward a bill and get as much support as possible, I will do that as well.
All right. Because obviously the reason they're not associated with cottage is because the government wouldn't let them do it. I mean,
they turned down their application to merge. I clearly remember that.
Yeah.
So, you know, we can't have it both ways at the federal level, right?
Sure you can. All right. Let me ask you, this is sort of a self-interest question, but there's a move to try to get some financial support for local news organizations. And I know a number of members in the House have signed a letter to the president about that. Are you on that, or what's your take in that area?
You know, I have heard about it. I certainly would be supportive of it. I will have to look into getting on that letter as well.
Okay, yeah. And I think the problem with it is, as I understand it, it's primarily aimed at news organizations with 1,000 or more employees, and obviously that's not going to do anybody any good where we live. So, but it's a problem. You know, there's such a demand for news, and you know, organizations like the Independent really need some support. Let me ask you this: you had to rush back to vote on this measure. What's the status of getting some system where you could have remote voting, where the members wouldn't have to be there and exposed to the virus?
Well, that was a second vote we were going to take this week. It was a proposition to take emergency measures that would allow us to come up with a proxy system that would have certain controls. So you just couldn't give somebody a proxy and say, oh, I'm voting for so-and-so. We would have to submit certain procedural documentation that would not provide proxy latitude, but be very specific on each and every vote, how we would vote. The second thing that was part of that package that was going to be considered is remote technology hearings, to be able to conduct hearings with some of these technologies that exist. It turns out that created grave concern, especially with our Republican colleagues. They were very concerned about that. So instead of voting on that package this week, it's my understanding that a bipartisan task force has been put together of both Republicans and Democrats, our leaderships, to try to come up with something in the next few weeks that will allow us to implement, should this pandemic and this circumstance where we're not able to come back continue.
And my understanding is that the Senate is leaving, correct? They're taken out, and so there's not going to be any new legislation until they get back either. And what's the timetable on, you think, the next round of this?
Well, keep in mind, Jerry, legislation is one thing, but we don't need, is my understanding, I could be wrong, but I'm almost certain, we do not need the Senate for us in the House of Representatives, assuming we have a majority, to modify our rules. The Senate does not vote on our rules, just like we don't vote on the Senate's rules.
No, I'm talking about the next round of bailout or recovery funding. Okay. You would have to have both houses in, right?
Absolutely, absolutely. But yeah, even though the recess, usually some work continues behind the scenes. But yes, you're absolutely right. In terms of moving forward, a CARES 2.0, they are recessing for about a month. So certainly for a month, we not likely will have another CARES 2.0. people could come back if they are able to get something together in the interim and bring everyone back. So it's not necessarily absolute that we will not have something for a month, but if something does get accomplished in the interim, we will, I'm certain that they would cut that recess short.
All right. Salud, I want to go back to this test thing because it just seems like that's the original sin of this whole pandemic and of the country's really inability to respond in a robust and comprehensive way. And I hear this from everybody about testing. What is your understanding of why we don't have a robust nationwide system for testing?
I think the bottom line, Jerry, is pretty simple. We did not have many tests available. This administration did not implement its Defense Production Act in a way that would have put more of these tests forward. The FDA and CDC did not have the type of prototypes ready to go as they should have. And so everything has been a very slow process. But the bottom line is we haven't produced many of these tests. As a matter of fact, up until a few weeks ago, they were finalizing which tests had the validity and the fidelity to be able to roll out, because everybody was coming out with some kind of test that they felt they could roll out. Keep in mind, the coronavirus comes in various strains. This is coronavirus 19, COVID-19. And certainly you could implement a test that would trace a corona virus, but not the one we're dealing with right now. So, but the bottom line is we haven't produced had the mass production of tests and then roll them out with some kind of uniform strategy where the states and the federal government are working together. Quite frankly, some states have relied on other countries like South Korea or other countries that have been more successful in coming up with these tests and rolling them out. But the bottom line, a lack of production, a lack of the Defense Production Act that wasn't implemented aggressively, and we're just trying to catch up now.
Do you think that's a reflection of the way that the president viewed the whole situation, that he thought it was a hoax?
No doubt. I have no doubt that this administration ignored, denied, and was lackadaisical about moving forward more aggressively to put in the measures and the systems and the actions that could have allowed us to get ahead of this. So there's no doubt in my mind that this administration is greatly responsible for the slow response, inadequate response we've had to date.
Is this thing going to pass tomorrow? Is it a bipartisan? I know it passed, I guess, by unanimous consent in the Senate. Is it going to go easily in the House? I mean, you wouldn't be there if somebody didn't object, I guess.
Yeah, but I think for that reason is it's unknown. It's unknown if it's going to be very bipartisan. It's unknown if we're going to do similar to what the Senate did. This is Washington. Unfortunately, there's always political gamemanship that goes on. I'm hoping not, because this is so important and such of an important issue for our country that I hope tomorrow we have a robust bipartisan vote to move this forward. But you could catch people from both sides of the aisle perhaps not voting for this for one reason or another. That's very likely. I think because of that, we were asked to come back and not take a chance so that there's enough votes to move this forward.
Yeah. So you were out here, more than a month, right? In the district? How much were you out and about?
It was almost a month. But don't forget, I came back for the vote that we had on Carriers 1.0. So there was a time where I came back for a couple of days. What I've been doing, very limited time out. I've been having a lot of Zoom, telephone conferences, teletown conferences, collaborating with my colleagues on both sides of the aisle. Actually, I just called a meeting together 2 days ago where I had Assembly Member Jordan Cunningham, Senator Monning, Senator Hannah-Beth Jackson, Assemblywoman Limon, and the chairs of the Board of Supervisors, Lynn Compton of San Luis Obispo, the chair of Santa Barbara County, Greg Hart, and not the chair of Ventura, but the supervisor that represents the supervisorial district in my district, that's Steve Bennett. We all had a good meeting to talk about all these challenges or gaps that might exist that we're not talking about in the local elected official meetings that are held a number of times a week. So what I've been doing, Jerry, is just having a lot of meetings, touching base with small business owners, healthcare officials, hospital officials, local governments, meeting and having meetings with as many people as possible, food banks, having meetings with chambers of commerce, small businesses, trying to touch base with as many stakeholders so I get firsthand the experience that they're having during this pandemic.
What do you view as the most pressing and urgent need that we have here?
I would say twofold. One is making sure we have the testing and ventilators and beds to address the need in case that surge does come to be. So that's one. And the other one is continuing to provide funding for the PPP program and the EIDL program. But the most urgent issue that, although smaller, but most significant from a one institution standpoint, is the logbook issue. We need to make sure we get our hands around that because it could strain and stress the entire healthcare system in Santa Barbara County, and actually the entire region. But relief for small businesses continues to be a major issue. Unemployment insurance for workers, and testing, beds, and ventilators.
And this state and local government thing is huge because,
Absolutely.
as you know, Sacramento is really going to get whacked 1 out of every 5 tax dollars. And that's going to go all the way down the line to the Santa Barbara County, San Luis Obispo County, city of Santa Barbara. So what do you think the prospects for getting some relief in that area are?
I think the prospects are good. The question becomes how much. And just like small businesses, local governments and states are going to be hurting pretty bad when you consider they have no more TOT money, sales tax dollars have been reduced, when you consider that the governor had good intentions of providing a sales tax relief to small businesses, but by doing that, he shortchanged local municipalities. So unless he's going to backfill with that federal money we sent him, he's created an unintended consequence that needs to be resolved. And again, we need to make sure that the federal government continues to do our part, but this is a collective effort. It's a federal, state, local government, private industry. We all need to work together.
Have you been in touch with the governor about that?
I've been in touch with his secretary, Office of Emergency Services, a number of times regarding the type of facilities that we need in our area, mobile hospitals, in addition, obviously, with the federal government as well. But I've been in touch with his administration on a number of things. For instance, the federal government has provided resources to state officials so that they could get out the funding for food banks. And that's something that food banks are still waiting to hear, to be able to get the guidance and the types of funding that they need to do their food distribution. So I've been working with my colleagues at the state level, legislators from our region, and also with his administration directly to make sure that the resources are going down to the local communities.
All right. Okay, Congressman, I really appreciate you being with us, and we'll let you go and go read that bill. How many pages did you say it is?
I don't know the exact page amount. I have it here. I'm going to read it. Hey, but I will make sure that we get anything you need to you soon, Jerry.
All right. Hey, listen, thank you so much, Salud Carbajal, for joining us, and good luck with the vote tomorrow.
Thank you. Jerry, before you go, how's the lighting? Is it,
It's
we have
better,
some lights.
it's better than it was when we started.